Hi everyone. In today's clip, I will talk a little bit about heel spurs. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. A heel spur, otherwise known as osteophyte, is an outgrowth that starts at the heel bone. When you look at an X-ray, the spur often looks like a small spike or hook which faces inside of the arch. This appearance looks like a very painful splinter. What an X-ray doesn't show is that the spur sits in line with the tissue fibers that it is embedded in, as opposed to piercing them, which is why most people don't notice their heel spur. A heel spur is made of calcium deposits that build gradually over many months or years. Spurs can develop anywhere that sort of tendon attaches to the bone, whether that be the back of the heel bone at the Achilles tendon or on other bones across the body. As a matter of fact, calcium deposits can be anywhere in the body, including artery. So coronary calcification, for example, is the process of calcium buildup in the plaque that exists in the walls of the coronary arteries. The coronary arteries play a critical role in supplying blood to the heart muscle. Restriction of blood flow to the heart can impact the strength of the heartbeat, its rhythm, and its overall ability to perform as it should. The symptoms of heel spur can be tricky to describe because most heel spurs sort of are asymptomatic. And most times when patients go looking for answers to their heel spur pain, they're actually looking for answers to their plantar fasciitis pain, but have confused the term due to the way it is commonly used. When heel spurs are symptomatic, they can aggravate the tissue that they're associated with, which in this case is the plantar fascia, producing symptoms including pain or tenderness in the heel of the affected foot, which can feel sharp, dull, or maybe even throbbing. Inflammation at the bottom of the heel or the location where the spur is present. Pain when walking or exercising without supportive shoes or in bare feet. The feeling of a small bumpy or bony bump on the bottom or back of your heel. Numbness, burning, and tingling if the nerves are impacted by the spur. Heel spurs have been shown to sort of develop in response to damage and strain to the soft tissues that insert at the bottom of the heel. In this case, the insertional fibers of the plantar fascia tissue. It can also be poor calcium absorption, contributing to overall bone health and potentially making bones more susceptible to issues like heel spurs. But poor calcium absorption also goes beyond just heel spurs and eventually will impact many areas of the body, as well as development of osteoporosis at a later stage. So when the plantar fascia, which connects to the bottom of the heel bone, repetitively pulls sort of on and places stress on the heel during movement, this creates microtrauma. The body responds by trying to repair the area by creating more bone. This becomes the calcified protrusions that we know as heel spurs. Anything that exacerbates the pulling and stress on the heel bone from the plantar fascia will contribute to the development of heel spur, including overusing the fascia, often from overtraining, wearing non-supportive or worn out or worn down shoes, muscle imbalances and dysfunction, rigid feet with poor mobility or flexibility that increase that are inadequate to absorb shock. Having a leg length difference between the two legs, bowed or knocked knees, abnormal walking and running patterns that place extra stress on the heel bone and ligament and so on. So heel spurs may also be caused by inflammatory arthritis and may be encouraged by other problems like the breakdown of a fat pad of the heel. Due to the similarity in symptoms between heel spur and other causes of heel pain like plantar fasciitis, confidently diagnosing a heel spur specifically includes taking a look at your medical and injury history, and also a comprehensive clinical exam and an X-ray. Even when a heel spur is confirmed via X-ray, it can be difficult to confirm if the pain is actually related to the spur or if it is coincidentally present while it is the plantar fascia tissue that is sort of producing the pain. Pardon me. Thankfully, the initial treatment for both plantar fasciitis and heel spur is the same, and the assessment performed by podiatrists should be comprehensive and designed to give you the most information and answers to why the pain has developed. Now, treating a heel spur includes custom prescribed foot orthotics, ASA or advanced surface ablation laser therapy, which radiates sort of specific wavelengths of light to reduce inflammation, support faster cell repair, and offer faster pain relief. A strengthening and stretching sort of program focusing on the joints and muscles in the feet and ankles. Gait retraining to address any biomechanical issues that could be contributing to the pain. Shockwave therapy to accelerate and facilitate the healing process. Dry needling of the surrounding soft tissue structure to release tension in the muscles by targeting sort of trigger points. And on the orthomolecular side of treatment, which can be complementary to what I have mentioned, the patient would need to consider lifestyle changes like engaging in heart-healthy diet and limit intake of cholesterol, fat, and sodium, quit smoking, limit alcohol use, exercise and maintain an active lifestyle, get rid of excess weight, and intake of vitamins such as high-dose vitamin C therapy, vitamin D3 and K2, because K2 transports excess calcium from where it shouldn't be to where it should be. K2 will remove calcium buildup from places like your joints, arteries, and other areas of the body and move it to the bone and teeth. MK7, for example, would be the best type of supplementation. Vitamin D3 will help the body absorb calcium properly. This vitamin works alongside K2 to help pull sort of the calcium deposits from wrongly deposited areas. Managing this includes also magnesium, which is critical if you have excess calcium, as it helps to balance out the calcium buildup in the body. Also, IP6 or phytic acid is another inhibitor of calcification, as it helps to pull calcium and other minerals out of parts where they should not be. Now, using castor oil packs have been known to also decrease inflammation and pain. Metaphysically speaking, heel spurs might be linked and indicate feeling unstable, ungrounded, or struggling with feeling secure in life, a lack of self-worth, or even rebellion against authority, as well as it could be due to trauma and stress, of course. Hope this has been helpful. Like and follow for more. Be the light.